So hello everyone, welcome to my another video. So we were discussing about the non-depolarizing muscle relaxants. We already covered the long acting class of the non-depolarizing muscle relaxants. Then we were discussing about the intermediate acting non-depolarizing muscle relaxants. We already discussed about Cisatracurium, Rocuronium, etc. So let's continue our topic of discussion. So the third one in the intermediate acting class of the non-depolarizing muscle relaxant is Rocuronium. So let's start our discussion. So Rocuronium is a monoquaternary aminosteroid non-depolarizing drug. I repeat, it is a monoquaternary aminosteroid non-depolarizing drug. Then the ED95 is 0.3 mg per kg body weight and the onset of action is around 1 to 2 minutes. The duration of action is around 20 to 35 minutes. And the most important point from the Rocuronium section, please have a note of it, that it is the only non-depolarizing agent which serves as the alternate to succinylcholine for intubation and because of its rapid duration of action. I repeat, Rocuronium is the only non-depolarizing agent which serves as alternate to scoline for intubation. Why is it so? It is so because of its rapid duration of action. So please have a note of it, and this point is very important from the exam point of view. Now it shows hepatic clearance, then slight vasodilative effects on circulation. So now let's read about Cisatracurium, the fourth drug from the intermediate acting class of non-depolarizing muscle relaxant. So what is Cisatracurium actually? It is a benzyl isoquinoline non-depolarizing muscle relaxant. I repeat, it is a benzyl isoquinoline non-depolarizing muscle relaxant. The ED95 of Cisatracurium is 50 mg per kg. Then the onset of action is around 3 to 5 minutes. The duration of action is around 20 to 35 minutes. Then the onset is slower than Cisatracurium. That is, the onset of this drug Cisatracurium is slower than that of the onset of Cisatracurium. Both belongs to the class of intermediate acting non-depolarizing muscle relaxant. Both this Cisatracurium and Cisatracurium. Okay, so there is one common point between them, that the metabolism of Cisatracurium as well as Cisatracurium is by Hoffman's elimination. The metabolism of Cisatracurium as well as Cisatracurium is by Hoffman's elimination. See, I have mentioned this point over here, that metabolized by Hoffman's elimination, just like Cisatracurium. Then there are no cardiovascular changes and no histamine release. I repeat, there are no cardiovascular system changes in case of Cisatracurium and there is no histamine release. So please have a note of it. So now let's read about Mivacurium. So Mivacurium belongs to the short acting class of the non-depolarizing muscle relaxant, the only drug from the short acting class. So I have mentioned it over here, that short acting non-depolarizing muscle relaxant, then it is a benzyl isoquinoline non-depolarizing muscle relaxant. Then the ED95 is around 80 mg per ml. Please have a note of it, that ED95 is around 80 mg per ml. Then the onset of action is around 2 to 3 minutes. The duration of action is around 12 to 20 minutes. So now let's look at the clearance of the drug Mivacurium. So the drug Mivacurium is cleared by hydrolysis by plasma cholinesterase. I repeat, it is cleared by hydrolysis by plasma cholinesterase. Then the greater the dose, the greater the breakdown, unlike other agents. The renal and hepatic dysfunction have minor effect on its excretion or clearance. I am repeating it for once again, please listen it carefully. It is cleared by hydrolysis by plasma cholinesterase. Greater the dose, greater the breakdown, unlike the other agents. The renal and hepatic dysfunctions have minor effect on its excretion. So please have a note of it. And one of the most important point from the exam point of view, that is neostic mean profoundly decrease plasma cholinesterase activity and hence interfere with normal rapid spontaneous recovery from block. I am repeating it for once again. Neostigmine profoundly decrease plasma cholinesterase activity and hence interfere with normal rapid spontaneous recovery from block. I hope it is clear. Now summing up our topic of discussion from the both depolarizing as well as non-depolarizing muscle relaxant section, that Atracurium is the safest non-depolarizing muscle relaxant to be used because it is eliminated by Hoffman's elimination, and hepatic or renal dysfunction doesn't have any effect on its excretion. I repeat, Atracurium is the safest non-depolarizing muscle relaxant to be used because it is eliminated by Hoffman's elimination, and the hepatic or renal dysfunction doesn't have any effect on its excretion. Can you recall that the drug Cisatracurium, just like the drug Atracurium, also showed Hoffman's elimination, isn't it? So we recalled one more point over here. Now let's look at the other point, that succinylcholine. We looked at this point 2 to 3 videos earlier in the depolarizing section of the muscle relaxants. Succinylcholine is the depolarizing muscle relaxant. So succinylcholine is the depolarizing muscle relaxant which is used to facilitate intubation. You already know that. And Rocuronium can be used in place of succinylcholine. Means Rocuronium can replace succinylcholine whenever succinylcholine is contraindicated to facilitate intubation. I hope I was able to make the topic clear to you. So this brings to an end to our discussion of the depolarizing and non-depolarizing muscle relaxant topic. I hope it helps. So if you like the video, please let me know in the comment section, and if you are new to my channel, please do subscribe to my channel. Keep watching, keep learning.